Hello Thomas, how are you today? My name is Dee. I'm going to be looking after you for this shift, okay? So I'm just going to have a quick look at your medication chart and see if there's anything that's due at this point. Okay, so firstly I'm going to check your name band, make sure we have the right patient. So it's Thomas Hoggs. And URN is 834567, 834567, and your date of birth is 16/1/1954, 16/1/1954. Can you confirm that for me? Okay, that's brilliant. Are you allergic to anything that you know of? No. Okay, so that's right. That matches what we've got here, that there's no known allergies. So have you had amoxicillin before? No? Okay, so actually you're prescribed 1 gram of IV amoxicillin and it's due now at 12 o'clock. Okay, are you happy for us to proceed and do that for you? You are? Okay, but before I get started, I'm going to have a quick look at your cannula and check that it's okay to use. So it's not looking red, no inflammation, no signs of swelling, and it's looking at your chart, it is just been put in yesterday. Okay, so we're in our 72 hours for use of your cannula. So I'm just going to go ahead and prepare your IV medication. All right. Hi Jerry, are you free to do a drug check with me?
Yes, what would you like to check?
Okay, so I'm looking after Thomas Hoggs, okay, and he is due his amoxicillin, 1 gram IV, and it's due at 12 o'clock, signed by the doctor, and he's actually not allergic to that. Great. Okay, so I'm just going to get what I need to get this ready. Okay, so I'm going to need this to clean my tray. I'm going to need a drawing up needle, a vial access cannula, a red bung. I'm going to need 1 for my vial, 1 alcohol wipe for my vial to clean the top, and 2 for my patient bedside. Then I'm going to need a 20 ml syringe. And the reason I know it's a 20 ml syringe, because if you look in the Australian Injectable Handbook, you'll see that amoxicillin, okay, amoxicillin sodium, so preparation, we're going to reconstitute for IV, because it says IV here, reconstitute 1 gram vial with 20 ml of water for injection. There is a warning in relation to people with hypersensitivity to penicillins, carbapenems and cephalosporin antibiotics, but thankfully Thomas isn't allergic to anything, so we don't need to worry. And because we're giving you by IV, we have an IV injection information here, and we're going to inject it slowly over 3 to 4 minutes, preferably over 10 to 15 minutes. Check compatibility with different fluids if you had another IV running. But because we're giving it over an IV injection, we don't need to worry. And we need to look at special notes as well. And rapid IV administration may cause seizures. So because of that, we're going to make sure that we don't do it any faster than the recommended 3 to 4 minutes. Okay, so my plan is to actually give it over 4 minutes. Okay, so now I need to do my calculation. So I just got some paper here. And we have, so the formula I'm going to use is stock required over stock strength by volume over 1. So my stock required is 1 gram over stock strength, which I get from my vial, that's 1 gram. And the volume I'm going to get from the Australian Injectable Handbook, because it told me I'm going to be using 20 ml of water for injection. So my volume is 20 over 1. So that means I'm going to be drawing up 20 ml. That'll be 20 ml I'll be giving to my patient. So Stock required over stock strength by volume over 1, so it's 1 gram over 1 gram by 20 over 1, which is equals 20 mils.
That's great.
Okay, happy with that? Okay, so I need my pre-flush, my post-flush, my label for my syringe, I've got my medication, and I've got my ampules for. Right, so I'm just going to label up write on my label so that I can stick it straight on my syringe as soon as I've drawn it up. So it's amoxicillin, 1 gram, and it's going to sign it because I'm going to prepare it. Okay, put that in there. And I'm just going to clean my tray. Put that in my bin. And my hand hygiene again. And then while that's drying, I'll do my first check with you. So I do my first check because I gather my medications before I start drawing up. Okay, so I have 0.9% sodium chloride, and it expires 2022, so that's my pre-flush. I have 0.9% sodium chloride, expires 2022. And that's going to be my post-flush. Amoxicillin 1 gram IV. I have amoxicillin 1 gram and it's for IV, and it expires February 25. Okay, and as per the Australian Injectable Handbook, I'm going to mix that with water for injection 10 mils, July 20 it expires, and another 10 mils which is water for injection 10 mils and it expires in July 20. Okay, I'm going to check the integrity of all my syringes. I'm using a Luralox syringe and it expires on 2024, and there's no holes or anything in that. So I'm just going to open that on the edge of my tray. I have a drawing up needle and that expires 2023, and the integrity of this packaging is intact too. And my vial access cannula or BD blunt plastic cannula is intact, and that expires in 2023. Okay, so that's ready to go. Okay, now I've prepared that, I'm just going to do some hand hygiene again, and then I'm going to put some gloves on. I also have a red bung to put on my syringe at the end. And I'll just check the integrity of that. So the expiry is 2024 and it's intact. So that's ready to go. I'm just going to get gloves. Pop these on. So as mentioned before, I'm just going to use one of these to clean the top of my vial. Sometimes these vials will come with a metal cap on top as well. So even when I take the metal cap off, I have to clean it for 10 seconds. So when we're cleaning, what we're actually doing is decontaminating the area. Okay, so old habits die hard. I quite often say cleaning, but what I'm actually doing is decontaminating. Okay, I'm going to let that dry. And while that's drying, I'm going to assemble my syringe. All the time I'm making sure that I don't touch my key part. Now that's my key part at the top. And again, I'm going to connect to my drawing up needle without touching my key parts. Okay, so now that's done, I'm going to take my cover off my drawing up needle. And you will get better at this. I don't know if you do this very often, Jerry, but you will get better at doing this and be able to do things without contaminating. Okay, so I've taken the lid off, made sure that I didn't touch that with my needle. So now I'm just going to draw up, making sure I don't touch that needle at all. I'm going to draw up my 10 mils. Okay, I don't throw that away until after I've administered my medication. I need that for my checks. Make sure I've got my 10 mils. Open my next file without touching the key part and draw up the next 10 mils of water for injection. Okay. Okay, make sure I have 20 mils. Get rid of that. Again, all the time, every time I go near it, I'll make sure I don't touch my key parts. So now I've got my vial access cannula, and I'm going to twist that lure lock on. Alright, so in the middle of my vial, you'll see there's a little circle, so I'm going to aim for the middle of that. And you need a solid surface to put this on because it does need a little bit of oomph to get through. Okay, so now I'm just going to inject my water for injection. And the aim is we're going to reconstitute this powder and it'll be in liquid, this medication will be in liquid format so that we can actually inject it. So you will notice there's a little bit of pressure, and you're going to gently agitate this to make sure that this medication is fully mixed. And then I'm going to use the positive pressure to draw it back once it's finally dissolved. Sometimes it takes longer than others to dissolve. Okay. And then I'm going to get rid of my bubbles. So you just need to tap it hard to get rid of those bubbles. Okay. And now just make sure we have 20 mils. Okay, 20 mils.
Great.
All right, so I'm now going to open my bung, have that ready, get rid of my vial access cannula. All the time you can see that I'm not actually touching the top. I'm going to hold this in place, peel this back and hold it back, and then I can put that on without touching. It's a handy little trick I've learned. Okay, so I can't put this syringe down until I have a label on, so this is my label that I prepared earlier. So you agree that it is amoxicillin 1 gram.
Yes.
And I'm just going to put this so it doesn't cover up any of our graduations on our syringe.
Great.
Right, you happy to do a final check or a second check?
Yes.
Okay, so now I've prepared our medication. We will do our second check. Let's do my hand hygiene. And then once we've done our second check, we'll go to the bedside.
Great.
Thank you. Thank you for your time.
So be patient.
Okay. So again, I'm looking after Thomas Hawkes. He is due, he's amoxicillin 1 gram IV. It's due at 12 o'clock and it's been signed by the doctor. He's not allergic to it. So I'm just going to check my tray. So I have sodium chloride 0.9%, expires 2022. That's going to be my pre-flush. And my post-flush is going to be sodium chloride 0.9%, expires 2022. And it's amoxicillin 1 gram IV, amoxicillin 1 gram IV, and expires February 25. And I mix that up with water for injection, 10 mils, expires July 20. Water for injection, 10 mils, expires July 20. And I now have amoxicillin 1 gram, signed by me because I prepared it, and it is 20 mils. Happy? Okay, so we're ready to go to our patient now. So I'll just do your hand hygiene and we'll take my file and we'll go to the patient and do our checks at the patient's bedside.
Right.
Hello Thomas, we're just back. This is my colleague Jerry and we're here to do some checks and before we give you your IV medication. You still okay for us to give you that? Yes? Okay. Right, so I'm going to start off with your name band. So it's Thomas Hoggs.
834567.
834567.
Date of birth 16th of the 1st, 1954.
16th of the 1st, 1954. Can you confirm your date of birth? And your name? Excellent. Are you allergic to anything that you're aware of? No? Okay, and that confirms with our medication chart that you have no known allergies. So you due your amoxicillin 1 gram IV and it's due at 12 o'clock and it's 12 o'clock now, so we're going to be giving you that. So I'm just going to be checking my medication that I've drawn up with my colleague. Okay, so here I've got my sodium chloride 0.9% pre-flush, expires 2022. I have my 0.9% sodium chloride, expires 2022, and that's my post-flush. Okay, so I have amoxicillin 1 gram, expires February 25. It's amoxicillin 1 gram and it's due at 12 o'clock. Okay, and I reconstituted that with water for injection, 10 mils, expires July 20. Water for injection, 10 mils, expires 20. So I got amoxicillin 1 gram and we have 20 mils. Are you happy?
Yes.
Excellent. Could you possibly get me some gloves, Jerry?
Sure.
Thank you. Okay. Just let that dry in. So I'm going to give this over 3 to 4 minutes, as the Australian Injectable book said. Okay, Thomas, so what I'm going to do is I'm going to start off by cleaning your cannula hub. Okay, so I'm going to clean it for 10 seconds. Okay, and I'm going to hold that and let that dry for about 30 seconds. Okay, so while I'm holding that, making sure it doesn't get contaminated, I'm going to prepare my pre-flush. Take off the cap. Make sure my key parts are protected. I'm going to get rid of my air bubble. Okay, and now I'm going to connect and I'm going to flush over 30 seconds. All the while I'm checking to see signs of any extravasation or infiltration, and check for any resistance as well. That's flushing nicely. There's no resistance there and there's no signs of infiltration or extravasation occurring. How does that feel for you? Comfortable? Okay, so that's the pre-flush done. So now I'm just going to give you your medication. So that's amoxicillin 1 gram. Take my red cap off. Make sure I've got no air bubbles in here. And now I'm just going to give this very slowly. Okay, so I'm going to give it over 4 minutes. All right, so just let me know how you feel. Okay, if you feel any way different from how you're feeling now. So I'm just going to keep an eye on my time. And your bed was at a perfect height for me. But if I was taller, if I was Jerry working with anyone taller who was giving this, they'd be raising the height of the bed to make sure it's comfortable for them. But given that I'm tiny, so how are you feeling? Yeah, good. So what have you got plans for today? Is it your family coming to visit? It's a great chance for me to get to know you while I'm giving this slowly. I don't often get a chance to talk because we're always busy. That's why I love giving IV meds. Still feeling okay? Okay, now I'm just going to flush that medication through. If I thought I'd contaminated your cannula hub while I was swapping, I would decontaminate it again by cleaning it with the alcohol wipe. So just checking for air bubble, no air bubble, and connect up. And I'm just going to flush my medication. I'm just going to flush a little bit slower than previously because of the medication that's in this line. But ultimately you're aiming for 30 seconds to flush. And that's all going in nicely. Okay, so how are you feeling? Just decontaminate that again. And to close my clamp. Now, Jerry or myself will be back and check on you within 15 minutes. So let us know if you feel any different than how you're feeling now. And you've got the call bell here in case you need it. All right. Okay, so we just need to sign. Okay, so we're just going to finish off by signing your med chart. Okay, so the 5th of the 5th and 12 o'clock medications. Jerry, could you co-sign for me?
Sure.
So we signed for the amoxicillin. I'll just update your fluid balance chart with the 40 mils that you've just received. Okay, so we'll be back in 15 minutes to check on you. In the meantime, you have your call bell, so give us a shout if you feel any different. Okay, see you in a bit. All right, pop that back. Hand hygiene. Pick up my tray, and we'll see you in 15. Okay.